So here's the first talk right on time. My intention was to cover the background in indoor CO2, and I could have a talk that goes through, all sorts of topics. But I'm using the recently republished ASHRAE position document on indoor carbon dioxide and the not fairly recently revised ASTM standard on CO2, indoor CO2, structure this talk on background. So I'm just going to go through these two documents, and as Valerie mentioned, there will be time for questions and answers at the end, or at least questions, answers we'll see. So the first one is the ASHRAE position document on indoor CO2. It was first published in February of 2022, and it was revised just last month. All ASHRAE position documents have to be revisited every 3 years, either reaffirmed, revised, or withdrawn, and we just made it under the wire. Here's a list of the committee that wrote this document, many familiar names there, and I'm just showing our first meeting, which took place 2 weeks after everything shut down. And some of us were better with our cameras and better with shaving and looking professional than others, but it's a good group of hardworking folks. And the document was written, because, as I said earlier, CO2 has been discussed in the context of ventilation and indoor air quality for centuries, but there's a lot of misinterpretation out there in terms of, how do you analyze and explain and interpret your indoor CO2 measurements. Also, there are a lot of trends that were of interest. More recently, studies of the impacts of CO2 exposure on human performance and human health, more standards and regulations, a lot of concerns about the accuracy of concentration measurements, less expensive sensors, and then most recently, more discussion of CO2 as an indicator of the risks of airborne disease transmission. So this is really kind of why we wrote this document. Here's an outline of it. It was the version that was just published this month uses a new format. So it talks about why CO2 is important and why ASHRAE cares about it. And then it has 6 positions, and this is an abbreviated form. We argued about wording a lot, but this doesn't reflect all that wording. And I'm going to go through these quickly. The first being that indoor CO2 concentrations do not serve as comprehensive indicators of indoor air quality, but they can be useful. The second one is that you can analyze the differences between indoor and outdoor CO2 concentrations using established tracer gas methods that we're all very good at, but those methods have assumptions and they require inputs, so you need to know what you're doing. The third one is that while there's some evidence of CO2 exposure impacts on health and so on, the evidence is inconsistent and it doesn't justify changes to our ventilation and indoor air quality standards just yet. The fourth is if you want to use CO2 to assess the risks of airborne disease transmission, you need to think about the space, the occupants, and you need to recognize that the differences between CO2 and aerosols. For example, a HEPA filter will take out aerosols but not CO2. The fifth is focused on the importance of sensor performance. And then the last is it notes that there's some air cleaning technologies out there that remove only CO2, which is an interesting concept, but that will not improve overall indoor air quality. It'll just reduce the CO2 concentration. And the position document also has a number of research recommendations. I think I see 9 of them here. I'm not going to go through these for the sake of time, but as you heard, this seminar will be recorded, so you can look at these at your leisure, or you can look at the document for more explanation. The position document also recommends some activity like standards and guideline development, educational programs like this webinar, guidance on using CO2 monitoring to control HVAC equipment, and so on. And then that's all that stuff is like the upfront 2 pages. And then the good stuff is in an appendix, which has a reference discussion to support the positions and recommendations in the position document. And it has a history of how indoor CO2 has been discussed in the context of ventilation and indoor air quality, the health and cognitive impacts of CO2 exposure, and so on. And there's a lot of good stuff in here. It's very well referenced. If you're really interested in the topic, I would, uh, suggest you take a look at this. So that's the position document. Just to wrap up, I think it does a good job in clarifying the relationship of indoor CO2 to ventilation and indoor air quality. And it's really written to targeting practitioners, policymakers, and others. It's not a technical document. It's really written a kind of a statement of what ASHRAE uh, believes is true about indoor CO2. And if the recommendations for research and new guidance are pursued, not just by ASHRAE, but by all of us, I think we'll all do a better job applying indoor CO2 and improving and using it to improve indoor air quality. Here's a link, but it's kind of clunky. There's like a lot of links. If you just search on ASHRAE indoor carbon dioxide, it'll take you to the position document. So that's the ASHRAE position document. The next thing I wanted to talk about is to kind of serve as background is this ASTM standard D6245. Oh, the ASHRAE position document is free. The ASTM standards aren't. That's kind of how ASTM survives financially. You may have access to a library or a colleague, or you yourself may be a member of ASTM and you can get at these standards, but they are not available for free download. And this standard was first published in 1998 as a provisional standard. That means it didn't go through all the full process of ASTM standard approval. It was felt that it was so important to get it on the street that we used a provisional standard route, and then we went through the full process. The last version was published last year, and there's a few issues that were identified in that balloting last year that are leading to some revisions right now. It should be republished again. Well, I don't want to jinx it, but I'll say later this year. So this standard starts with a scope, as all ASTM standards do, and it speaks to the background on the health, comfort, and performance impacts of CO2 exposure. Talks a little bit about CO2 limits and other standards and regulations. And then the scope kind of lays out what's in this standard. And I'll go through all of these in just a minute. It covers the estimation of CO2 generation rates from people in section 6. It talks about the relationship of CO2 to indoor air quality in section 7. Section 8 then discusses how CO2 concentrations can be used to evaluate ventilation, also to control ventilation systems. And then sections 9 and 10 talk about measurement issues and continuous indoor CO2 monitoring. So I'm going to go through these 6 sections again fairly quickly. So section 6 is on CO2 generation rates. How do you estimate them? A lot of applications of indoor CO2 require a value for how much CO2 the occupants are generating. And the content here is based on a paper I wrote with a colleague in 2017. And there's an equation to estimate the CO2 generation of an occupant that's based on science, based on the science of metabolism and physiology. It requires information on the occupant, sex, age, body mass, and their level of physical activity. And there's some data in the literature, from the literature in the standard, like MET rates in this upper left-hand table. And then it has some tables of CO2 generation rates by sex and age is shown kind of in the middle table. And I'm sure you can't read it, but it has the age, males, females, and CO2 generation rate for different met rates, different levels of physical activities, and it uses the mean body mass in each age range. And body mass is a variable. There's a distribution. So the lower plot on the plot on the lower right kind of reflects that distribution. And I'm only show this because I was able to learn how to make such complicated plots in Excel. And this approach is an alternative to the approach in the ASHRAE fundamentals, which, with all due respect, is not explained technically. It uses old metabolic rate data, and it only considers the sex and age of the individuals indirectly. So section 7 talks about CO2 and indoor air quality, discusses the relationship of CO2 levels to the perception of human body odor. And there's a plot here. I think Bjarne shows us the same plot. Basically, shows the percent of people, of unadapted visitors who were dissatisfied with the level of perceived body odor as a function of CO2 concentration. This is a lot of studies out there on this over the years. So it talks about CO2 and body odor perception. It also talks about the limitations of using CO2 as a metric of indoor air quality. CO2 might be a fair metric of indoor air quality associated with contaminants that are linked to the number of occupants. But there are a lot of contaminants that are a lot of important indoor pollutants that are independent of the number of occupants: outdoor air pollutants, building material emissions, cleaning products, and so on. And then the last section of this, or last subsection of this section 7, talks about CO2 and the infection risk. And it kind of lays out, if you're using CO2 as an indicator of ventilation, that's one thing, because, more ventilation should mean lower risk. If you're using CO2 as a more direct indicator of risk itself, using concepts like rebreathed air, that's a different thing. And the section talks about that. Section 8 talks about using CO2 for ventilation, and there's a couple different options. You can use it to get the percent outdoor air at an air handler by looking at the CO2 concentrations in the different air streams. CO2 can be used as a tracer gas to measure air change rates. There's an ASTM standard and an ISO standard that tell you how to do that, with all of them with important assumptions. The most important being that all these methods apply to a single zone, and some zones can be characterized as a single zone and some can't. Fourth discussion here is using CO2 as an indicator of ventilation adequacy relative to some target ventilation rate, and that's described in a paper, an indoor air journal paper I wrote in 2022. You can see a little picture of the title here, and that concept can be it's easier to use. There's a NIST tool here that's listed in the references. And there's a short discussion of using CO2 to control outdoor air ventilation rates, but this is not an application guide. It doesn't lay out the algorithms and so on. And then section 9 is about concentration measurement, has some short discussions of error, calibration, and so on. And then the last section is on continuous monitoring, timing, how long do you monitor, the importance of archiving, and so on. And the plot on the right is from a paper I wrote with a colleague in 1990, and I like to show it because the outdoor concentration was 350. And just to wrap up, the standard is a guide. It's not a test method or practice, but hopefully it's useful. And hopefully it can reduce the misapplication and misinterpretation of CO2, but we still need formal methods of test for measurement analysis, and hopefully some energetic volunteer will work on those. And here's a reading list of just some of these documents and some related documents that you might find of interest. And with that, I will conclude